Imagine a world where a simple cut could be deadly. Picture hospitals overwhelmed with untreatable infections. This is the looming threat of antibiotic resistance, a silent pandemic that could plunge us back into a pre-antibiotic age. Bacteria, invisible yet ever-present, are constantly evolving. They adapt to survive, even against the most potent drugs we can devise. Antibiotics, once hailed as miracle cures, are now facing an unprecedented challenge. The very weapons we rely on to combat bacterial infections are losing their effectiveness. This is not science fiction. It is the reality we face if we fail to address this critical issue. The discovery of antibiotics revolutionized medicine. Before their advent, even minor infections could be fatal. Alexander Fleming's accidental discovery of penicillin in 1928 marked a turning point in human history. Suddenly, diseases that had plagued humanity for centuries became treatable. Antibiotics work by targeting specific mechanisms within bacteria, disrupting their growth or killing them outright. Penicillin, for example, interferes with the formation of bacterial cell walls, rendering them vulnerable. This new arsenal of drugs ushered in an era of unprecedented medical progress. The effectiveness of antibiotics, however, has come at a cost. The overuse and misuse of these drugs have fueled the rise of antibiotic resistance. When bacteria are exposed to antibiotics, the most susceptible are killed off. This selective pressure allows resistant strains to survive and multiply. This resistance is exacerbated by several factors. The overuse of antibiotics in human medicine, often for viral infections against which they are ineffective, contributes significantly. Furthermore, the widespread use of antibiotics in livestock and agriculture as growth promoters further fuels the problem. The consequences of widespread antibiotic resistance are dire. Common infections could once again become deadly threats. Simple surgeries, now routine, would carry enormous risks. Organ transplantation reliant on antibiotics to prevent rejection could become impossible. The post-antibiotic world would be a stark reminder of the pre-antibiotic era. The progress we have made in healthcare would be reversed. The hard-won gains in life expectancy and quality of life would be threatened. In Section 5, the silent pandemic, healthcare in peril. The impact of antibiotic resistance extends far beyond individual patients. Hospitals already battling healthcare-associated infections would face an unprecedented crisis. The cost of treating resistant infections, both in terms of financial resources and human suffering, would be astronomical. The very foundation of modern medicine rests on the availability of effective antibiotics. Without them, our ability to treat infections, perform surgeries, and manage chronic conditions would be severely compromised. Section 6, the quest for solutions, battling back against resistance. Despite the challenges, scientists are working tirelessly to combat antibiotic resistance. New approaches to drug discovery, such as exploring the potential of bacteriophages, viruses that infect and kill bacteria, offer promising avenues. Artificial intelligence is also being harnessed to design novel antibiotics that target bacteria in new ways. Global surveillance programs are tracking the emergence and spread of resistant strains, providing crucial data to inform public health interventions. Section 7, Beyond the Lab, a global call to action. Addressing antibiotic resistance requires a multifaceted approach that goes beyond the laboratory. International collaboration is crucial to share information, coordinate research efforts, and implement effective policies. Public awareness campaigns are essential to educate people about the importance of responsible antibiotic use. Policymakers must enact regulations to curb the overuse of antibiotics in both human and animal health. Section 8, Stewardship and Responsibility, using antibiotics wisely. Each of us has a role to play in preserving the efficacy of antibiotics. Antibiotics should only be taken when prescribed by a healthcare professional. It is crucial to complete the full course of antibiotics, even if symptoms improve, to prevent the emergence of resistance. Simple hygiene practices such as hand washing can also significantly reduce the spread of infections. By adopting these measures, we can collectively contribute to the fight against antibiotic resistance. Section 9. Investing in our future, supporting research and innovation. The development of new antibiotics and alternative therapies is paramount. Increased funding for research is essential to accelerate the discovery and development of novel treatments. Support for innovative approaches such as phage therapy and AI-driven drug design is crucial. Investing in antibiotic resistance research is not just about combating a future threat, it is about safeguarding the health and well-being of generations to come. By supporting research and innovation, we are investing in a